Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Brad, we have a real treat for our viewers today.
Now you better believe
We got a real
treat.
live patient here, former patient who had both knees replaced, which is really quite a feat, and she should receive a medal for that.
You bet.
And we're gonna get her perspective on what it was like and ask her some questions and maybe take a look and see how it's moving.
Right.
So-
And if you're in the situation and you got both knees that the doctor says you go two at once, this would be a great video to watch. You're gonna get some first-hand information. So are you ready, Chris?
I am.
Okay.
All right, yeah.
All right.
Did you wanna have her stand up right away and show how, what kind of motion, Sarah, can you?
Go ahead.
Yeah, show what kind of motion you have here.
I
On the
actually
chair.
have a ton of motion. I
So, you wanna,
can bring my knee up.
show from the side.
Yeah, show it from the side.
This one, I have to hold it.
Yeah.
Look at that, that is really good motion.
Now do the other one, because she had both done
Both
at
done.
the same time, the same operating.
Yeah.
You're right, this one is a little bit
Yeah,
tighter.
it's a little tighter, but that's still that's above average, I would say, very good motion. So,
All right.
And I can go down this
Look at
far.
that.
Move that chair out of the way though. We
Yeah.
gotta face that way and do it, Chris.
Alrighty, and I'm gonna move my chair this way.
squats, excellent.
And what was the date of your surgery?
It was April 14th, 2014.
Okay, so just a little over a year ago. And you've been this mobile
You can
for
have a
how
seat.
long?
I went back to work at about 2.5 months after surgery, and I own a restaurant.
So what kind of duties do you, I mean, are you just at your desk?
No, I did that much earlier, but when I got active, whenever they needed help, I remember one particular Friday, and it was 2.5 months after surgery, we got really busy all afternoon, so I helped the cook. But I had to go out on the floor because I couldn't keep up, so I was actually waitressing tables
Sure.
at 2.5 months.
Wow, nice, especially having both done.
Yeah,
So you've got a restaurant, smaller, not a smaller restaurant, but where you're the owner and you
Right.
pretty much help out, you do everything
I
from.
cook, I do dishes, I make salads, I waitress, I bartend, I wait tables in the bar, I do whatever,
And you cater.
and I
to-
cater.
And you do all the cooking for the catering,
I
is that
do.
correct?
Yep,
So you've got 150 people, you're doing the
it's
cooking?
more like 300. but yeah.
Okay, sorry.
And she's the
But I
bouncer.
have assistants
She's the
because
bouncer at the
I
restaurant.
can be a
too.
bouncer too, I have been, yes.
And she does have it downstairs to the restaurant.
She does.
And that's where the banquet room is, and you go up and down the stairs?
Yep,
And are you able to carry anything going up and down the
I
stairs?
just started carrying stuff.
Mhm.
You know, I felt better hanging onto rails, so I'd carry small things in one hand and hang onto a rail. But at the point where I'm at now, I'd say for probably the last 6 months, I forget that I had my knees
Oh,
done.
that's
And I
nice.
bounce down the steps.
Then you know you're doing well.
Yeah, and when I go up before someone, if they can't catch me, when I get to the top, I go, oh my gosh, I really beat them. And it isn't like a thought while you're doing it, you just do it.
This actually brings up a good point though, Brad and Chris. I don't want you to compare yourself to her. She's done very, very well. But we always tell people not to compare themselves to other people because their rate of
Right.
recovery is going to be different. But we also say one knee is going to tend to be better than the other. And was that the case
That
with
is
you?
true, yes.
Did one recover quicker? Did one, or
That I didn't notice, I just noticed, like I really thought I had better
Motion
range
on
with
this
this
one.
one. This was the worst knee, and I think this one had the most discomfort
Okay.
through the mid stages, not the early. The first part is all surgery pain, and that's so important to get in your head. It isn't your knees that hurt. You can get up after surgery and do anything if you can get past the pain,
Sure.
but you can't. Pain's,
Right.
there is
It's
pain.
going to limit you.
Right, so I told myself every day, it isn't my knees that hurt, it's the surgery. It's the cut, it's the stitches, it's the muscle,
Sure.
it's all that, so I
Yeah,
read.
everything's glued in place.
Yeah, well,
and
he
it's not
told me,
moving.
he moved it every way you could move
Yeah.
it before he stitched it up, and I was like creeping out.
Yeah.
To me, it was just really important to know that it wasn't my knees that hurt. But I read somewhere that the more you use your knees, the more you stand on them, the compression on your bone initiates growth and
Yes, it
healing.
does. Wolf's Law.
Mhm.
So that is true.
Yeah.
Because I use that for my premise. So I walked as much as I possibly could. As soon as I could advance to a walker, I was walking constantly.
So what, when you had the knees done, what were your pain levels at? Could you give a number between 0 and 10?
Before I had them done?
Before she had it done. What prompted you to have it done?
Well, I'll tell you what prompted me. I was in a car accident and my knees hit the dash and I thought I cracked my kneecaps. And that's why I went to the doctor.
Okay.
And he laughed and said, nope, they're fine. The rest of your knees are shot.
The joints were bad.
Yeah, and I knew I had discomfort, but you grow into it, and that's
You get
probably the
accustomed to it.
biggest problem with not knowing how bad your knees are, is every day you just get more and more used
Right.
to it. The thing that amazed me is the people that came up to me that come to our restaurant and said, I cannot believe how you stand compared to how you
Sure.
did before your surgery. And I go, what? And they said, you stand up straight.
Mm-hmm.
And before you were bent over and you kind of waddled side to side.
Yep,
And the inside of my bones were bone on bone,
sure.
so your legs kind of go out this way, and you
Yeah.
don't realize that.
Yeah.
Sure.
So that, to
And
me,
that
that
brings
was
up a good point too,
surprising.
because Brad and I would say we're big advocates of probably having the surgeries done sooner rather than later.
Mhm.
And a lot of people, they don't want to use a walker or a cane, and but they'd rather waddle
Yeah.
than do that. And they don't realize, like you said, this thing all happens so gradually. You don't
Mhm.
realize that you've lost some height.
Yep.
And that you've lost the ability to walk normal.
And you do,
Right.
you don't realize it,
Mhm.
but when people come up and tell you,
Right.
and you start
They
reflecting.
all notice it.
Oh, yeah.
Yeah.
I had a girl that helps me with catering, she's one of the servers. She said, I don't know how you did those, you used to lean on the counter to take the pressure off your knees. And I said, why didn't you tell me I did that? I didn't even know I did.
Sure.
Now,
But-
is it okay if we ask you your age?
I'm 62.
You're 62.
Mhm.
Wow, she looks so much younger.
Yeah.
Thank you.
So you were
Got it from my mother.
you were 60 or 61
I
when
was
you had.
61 when I had my surgery.
Okay, and then after surgery, did you go home or what was?
I came to Houston Nursing Home. When we remodeled our house, we made it very handicap accessible for when we age, not realizing we'd be using it this soon. And I just didn't want to, I didn't have the room to walk is what I
Sure.
kept thinking. And everybody in their home, most people have a circle you can walk around, but you have furniture in the way, you have ottomans, you have this, you have that. And we would have had to go this way and
I
back
don't
and
think you need to
forth.
make an excuse for
Yeah.
having to come in.
Well,
because
no,
you really
but I
don't,
mean, that
because
was part of
you
my
had
thought
both- You
process.
had both done.
Right.
And you're gonna get more intensive
Yeah.
therapy at a nursing home.
Yep.
I mean, it's gonna be, you're gonna get it every day, you're gonna get it twice a day, and it's just gonna be a
And
lot.
walking,
Right.
the walking halls to me was the
Exactly.
big part.
Yeah.
It was a football field from my door to physical therapy.
Mhm.
So I walked
Sure.
that 6 times a day, and you can't do that anywhere but a facility like this.
That's right.
Right.
You
Exactly.
need those hallways and this type of an environment. And the help I got, the therapy, the nurses, I
Yeah.
mean, everything was just a big perk on top of being
But
able
going
to do
back to,
that.
I'm gonna bring your age up again, because you're
Okay.
probably on the younger end of the scale for having knee replacement.
I am.
And a lot of people would maybe have said, you know, you really should wait as long as you can. We all argue about that, because here your quality of life, you know, here you're at kind of the prime of your life somewhat. You know,
Mhm.
you're working hard and you were suffering,
Mhm.
you know, trying to do all these things when you could have the knee replacement done, and, you know, over the last 15, 20 years, maybe longer, you know, at that point in your life, quality of life, not that it's not important, but you're not gonna probably, working like you are now, when you're, hopefully not.
The Energizer
Maybe.
Bunny.
You know
But
what I
it's,
mean?
my kids kept saying, they wanted me to do it, so I
Yeah.
could play with my grandchildren. I have a lot of
Exactly.
grandkids.
Sure.
And this, I mean, I actually ran the other day with my 4-year-old grandson.
Wow.
I mean, I didn't just
Yeah.
take steps, I actually ran.
Oh, don't tell the
Not
surgeon.
fast, not fast, believe me, it wasn't
I
fast.
think limited is
Yeah.
fine,
Sure.
but yeah, I mean, it's
Yeah, but I
ongoing.
mean, I couldn't have done that before my surgery. So to me, quality of life is really important, because I am only,
Oh, it
in the big
is.
scheme, I'm only 62, and
Yeah,
I just talked to
exactly.
a lady in her 80s that got it done.
Mhm.
And you know what I said to her? I would have sat in a wheelchair.
Yeah.
But she, you
I
know,
mean,
and
this-
she didn't want to.
Again, this
It's
time of your life
important.
is really an important time of your life to
I
have
agree.
high quality, and why wait and
Yep.
suffer during those years?
I've had people as early as 46 and as late as 92.
Yeah.
Yeah.
Wow.
Yeah.
You gotta take your hat off, that's gotta be incredible.
Yeah,
How old
he
is
did
Rosie?
well. Well, we don't have to.
What was that?
Nothing, I don't want to
Another
bring Rosie
question,
into it.
Brad?
No, I just wanted to sum up so you had the surgery, you spent how many weeks in a nursing facility?
I was,
3 or 4
I
weeks?
was, no, I was 3 weeks, I think.
Okay, then you went home, then outpatient therapy
Yes.
3 times a week
Yep.
for another month or so, I believe.
Oh, I think it was a
Maybe-
couple months.
Yeah, maybe it was
Yeah.
a couple months.
Cause I was
And that's
walking
not unusual.
really,
Right.
really good when I was done with physical therapy.
Right, and we really wanted to, I was, for outpatient, she was working at our facility in a
Yes.
different place.
And
but-
I never told you all the stuff I did at work, so you wouldn't yell at me.
But you know, we were getting her for a higher level than most people.
Right.
You know, to get up and down, I remember specifically at the end of therapy, I've gotta get up and downstairs
Yep.
with confidence and holding on to
And
things.
how
So-
quickly did you get to the point of not walking without a gait aid, a walker or a cane? How
You don't
fast
even-
that-
When I was in the nursing home, and I'm gonna say maybe 10 days out, and I was getting up and, I'm not a very patient person, so I taught myself how to dress myself, how to take my own showers. But once I was getting dressed, I would let go of everything and take steps over to get my clothes and bring them back, so.
And
I
don't
was-
compare yourself to her. This is,
And don't do this.
and don't do
This
this.
is our,
Not a lot of
Breaking
steps.
all the
I mean, it
rules.
might be 3 or 4 and then back,
Sure.
and I know if they saw me, they'd scold me. And when I was at home, I'd let go of my walker intentionally and take 2 or 3 steps to a table and come back. And I had my husband and my sister Barb there to help me,
Sure.
who both of them would go, "What are you doing?" I go, "I'm fine, just let me do a
You
few
have
at
good
a
judgment
time."
though too. I mean,
Yeah.
you had a good sense of what you could
Well,
do. and
I
what you
felt I
couldn't.
had good balance. If I
Right.
didn't, I never would have tried it.
sure.
Oh.
So,
You have any other questions, Brad?
no, I was just gonna say, is there any other recommendations for people that may wanna have knee surgery, that any big,
To be honest, I don't wait. Go in and do it and get it done and take care of yourself and do what your body tells you to do, which sometimes isn't always what a doctor tells you to do or a therapist. You can achieve more, and you don't have to try to copy somebody, but use it as a goal to get there.
Okay, we were talking about narcotics and you were gonna let us know how long you were on the head.
Pain
stuff.
pills?
Pain pills.
Pain
Pain
pills,
pills.
yeah. So my surgery was in April, and I believe I took my last ones in July.
Okay.
And, you know, I had a husband very concerned, and I had a sister very concerned, because you take a large dose,
Right.
and they put you to sleep. You sleep through most of your pain in the first 2 weeks. But as you go on, you're like, oh, I don't wanna keep taking these. And so you get kind of weepy, and I don't think I should take them. And you hurt, so you get really whiny, and then you end up calling the doctor and saying, to his nurse, of course, you know, I don't wanna take these anymore, and I don't know what to do. She's, you still need to take them, I can tell by the
Right.
tone of your voice.
Exactly.
So what I've learned is that when you hurt, you need to take them, and you can't do the correct therapy without taking
Yeah,
them,
your
because your
therapy's not gonna go
motion is
anywhere.
limited because it hurts so
Yeah.
bad. So you have to take them. Your problem starts when you take them when you don't have pain,
Right.
and that's when you have a problem.
Yeah, I don't think there's any problem in going into a few months, that's
No.
for sure.
Right.
Well, like
It's-
mine was almost, 3 months when you
Yeah.
look at it.
and you taper it off, didn't you?
I tapered off. I can't remember how many you take at first. But I know that I was down to 1 in the morning and 1 in the evening.
Sure.
And then I just took them in the evening so I could sleep good. And then one night I looked at my husband and I said, I'm not gonna take them. I'm gonna try and see how I do.
Mhm.
And I
It
did
sounds
great.
like she did it just perfect.
You
It's,
bet.
People one and then
Right.
go down to just the evening, and that's what I've seen so many people do successfully, so.
All
And
right.
it does help to take the one at night to help you sleep, because your
Yeah.
sleep is really important.
Yep, you need that for the recovery
Right.
time, that's all, the recovery time is just as important as the exercise.
Right.
Oh, it is, it is.
So, all
So,
right.
Chris, we wanna thank you
Sure,
for your
thanks.
time.
Appreciate
Yeah,
it. Very,
thanks a
very
lot.
much.
You
Thanks
know,
for
I
having
don't
me.
know if you know this, but we always say we can fix just about anything except for
A broken heart.
believe it, better, believe it. So
Love
subscribe to us if you would like to have more information and helpful hints and be vibrant, and what else do we say, Bob?
Right.
Just,
Oh my
yeah,
God.
they're not listening anymore anyways.
Okay.
Very